watching Good Morning San Diego.
Welcome back here to Good Morning San Diego. We all knew this. There are going to be some changes to your health care coming in 2013 and beyond. Healthcare insurance broker Craig Gussin is here to explain what you can expect. Good morning. Thanks for coming in.
My pleasure.
All right, let's start about January 1, 2013. Just a few days away. Rates are starting to go up. What does that mean for most people?
It means that rates are going up anywhere from 8 to 10%, KUSI has said, to easily 18 to 25% for almost every other health carrier out there. And right now, all my clients are calling me up saying, what do we do? And most companies are coming out with the new rates and new plans effective today or tomorrow. So we're waiting to see exactly what they come up with to help save money.
They're pretty expensive already.
Yeah.
You gave me this. This was a bill. What was it, your mother?
My mother-in-law.
Your mother-in-law was in the hospital, $3,400 a day, but they charge her $48 a day for her cholesterol medication.
Exactly.
Which the cholesterol medication on a monthly basis is a lot less expensive.
About $15 a month. But so what you realize is people go, they want to blame the insurance companies. Rates are going up and up. But on the other end, if you spend a couple days in the hospital and you're getting charged all these very expensive costs, the insurance company has to pay for it.
Yeah.
So one of the ways of doing it is looking at the cost of what they're spending out of pocket. The insurance companies have to spend 80% of every dollar they bring in for medical care. So they get to keep the 20% to pay for taxes, to pay for administrative costs, and possibly make a profit. Most companies, if they end up only spending, 79% of the money, they have to give a rebate back to the consumer. If they spend 81%, then they're going to lose money on the deal. So they really have to pinpoint it. But when you start getting charges that they have no control over, such as hospital bills, medical supplies, that's a big issue. Yeah. And that's a big concern. And companies right now are trying to adjust the rates.
Trying to make up their own losses. Now the Affordable Health Care Act, much of it goes into effect in the year 2014. So we've got a year to prepare for some of those major changes. What can we do while we're waiting for 2014? Come
January 1st, 2014, everybody can buy health insurance, no health questions asked. It's a guaranteed issue, you can get it. But California has the 8th lowest rates in the country, and I've been saying for years our rates have nowhere to go but up, and you're starting to see it. So what people can do is start looking at their existing plan and saying, if I increase my deductible on my health insurance, will it save me enough money to make up for it? And that's what we're doing. We're having clients who, in the past, went from a $500 deductible to a $1,500 deductible, and they save more than $1,000 a year in payments. That helped them. So we're looking at that, and we're looking at new plans the insurance companies are coming out with to help lower the cost.
Okay.
Like with group plans, they have generic only prescriptions. Some plans have a limited network where you can only see a certain network of doctors, and by doing that, it helps reduce the cost.
It gets very complicated. The Affordable Health Care Act may be a bit of a misnomer because it seems to be costing more in your premiums and your rates and whatnot. So
exactly.
We'll go to people like you to help us sort this all out.
It is, and you're a guide. You need maternity coverage. No, but the state of California requires every person in California to have maternity coverage.
Okay.
That raised the rates. The $63 a year bill that you just heard about, that just came out, the fee, that's $5.25 a month that everybody's going to pay next year.
Very expensive. Craig Gussin, thanks for your insight. Really appreciate it.